Dat is 2 uur geweest. Good afternoon. We are going to start within a couple of half a minute. Er 58 mensen die mooi. Strakke tijdsplanning. Okay, we are going to start. Good afternoon. I greet you from The Hague in the Netherlands. On behalf of the Eureka partners, I welcome you to this meeting. Due to the corona crisis, we meet online via Zoom. Let's hope that the next meeting from Eureka will be live, I presume, in Brussels. I'm already looking forward to meet you all in person. But first, let me introduce myself. My name is Martijn da Costa, and I'm head of the department People with Disability and Chronic Disease. My colleagues and I represent the Dutch Health Organization for Research, ZonMW. ZonMW is one of the partners of Eureka Platform. Eureka Platform is a European collaboration platform of academic researchers and service providers. Our goal is to work on an inclusive community, planning and development, in the perspectives of the United Nations Convention of the Right of Persons with Disability. ZonMW became a member of Eureka in spring of this year. We joined Eureka. From the start of joining it, ZonMW has pleaded for participation of people with disability or chronic illness in research. Using peer expertise in research is a part of that plea. Eureka, as a modern platform, fully agreed with this vision, and so do lots of others. In the research world, everybody now knows that good research goes hand in hand with the input of peer experts. But still, involving peer experts and participants in research projects, policy and implementation doesn't come naturally. Peer experience is very important to succeed fully in participation. People with a disability or chronic illness have a much harder time participating in social life, whether this has to do with work, accommodation, social activities, or mobility. Improving participation is therefore the aim of all the activities undertaken within this theme. In the research world, everybody now knows that good research goes hand in hand with the input of peer experts. But how can participation best be realized? That's one of the questions which should be answered during this meeting. ZonMW contributes to this improvement through knowledge development and by promoting the dissemination and practical application of this knowledge. This cannot succeed without the involvement and practical experience of the target groups themselves. So these are given a central importance. We have chosen for the theme mental health and peer expertise, but why? In fact, for two reasons. In Europe, the peer expertise in mental health has been developed for several years, with good and positive results. Other target groups can benefit from those experience and expertise. For example, the group of people with disabilities can be used by the field of people from mental health. So I'm interested to know how and where those similarities are. And now we go to the program. Within a couple of minutes, I'm very pleased to interview Ode Holland. She is an expert in peer expertise. Dan Berendsen and Marionneke van der Vette will give their Dutch view on this topic. On behalf of the Fundación Mundo, Bipolar, Guadalupe Morales gives the Spanish approach of implementing peer expertise. And of course, it's not only listening, but also doing. So we have 3 breakout sessions with the titles, How do we implement peer expertise and services? Has implementing peer expertise been proven effective? And what are points of action in research and practice? And thirdly, how can digital technology support ongoing processes? Is there specifically technologies designed with peers with expertise? And of course, we do hope that we have some important conclusions about the peer expertise. The wrap-up will tell us. It's important to know that the results of today will be the input work for the working plan of IRECO during the coming years. It's usual to have an informal meeting after the event, but due to Corona crisis, you have to make your own drink, get your own nuts and chips. But we all hope that drinking together and have a personal chat will be possible again next year. We all hope so. Before we go to start the program, in fact, I have some practical remarks. This event and the sessions will be recorded and will be available online for a greater audience. The link will be shared with the participants later. If you have any questions, please ask in the chat. Our moderator will collect these questions. If there will not be enough time for all the questions, please send your contact details in a private chat to us so we can contact you later. You will be assigned to the breakout sessions rooms automatically, based on which you have signed up for. If there's any trouble, please let us know in the chat. In each session, there will be a moderator and a technical host. Please use the chat if there are any problems. And finally, we would like to encourage you to stay till the end for the final remarks, although we have no common drinks or chips or nuts. And now we are going to the real program. First, I may interview Oda Holland. Oda is from Norway. She is a peer worker and a sociologist of the University of Oslo. Good afternoon, Oda.
Hi, thank you for having me.
I'm very satisfied that it's possible to interview you. Mm-hmm. How's the weather in Norway? It is here gray skies and a bit raining. How is the Norway?
It's actually sun for the first time in several days, so I'm happy about that.
We still have differences in Europe.
Yeah.
You are working as a peer expertise. Why is that so important for you?
Well, I think peer expertise is important because it affects other people working in the field. It makes them think about how they are meeting people in a different way. And I think what I see working in the mental health field is that peer workers, they can affect the organizations by reducing stigma and bringing a new understanding into how we meet people. And to me, it's also important that I can see that people that I help directly feel less alone. And they feel more hopeful for the future because they know that peer workers have been struggling as well. And so peer workers who have gotten to the point where they have a job and they affect services can sometimes inspire people who are struggling right now. Yeah.
You're speaking about reducing stigma.
Yeah.
I can give you an example of it.
Well, I think if you look at the way mental health services have been organized previously, it has been a really a big focus on diagnosis and on categorizing people. And when peer workers come into the field, they can talk about what it feels like being categorized and what it feels like being labeled. And it can give the workers and the policymakers new knowledge about what we have to be careful about when we are talking about real human beings. And I think language is also very important. The words I use to describe people might be different than somebody who's been working in the field for maybe 30 years.
Okay, okay. What motivated you to these kinds of activities?
The activities I do at my work is both one-on-one and developing the services. And the thing that motivates me is that I can see that we need to lift the voices of the people who we are trying to help. So when I talk to leaders and policymakers, I can sometimes see that they don't have the deep understanding of what it feels like being a person that needs help and needs to come to someone and be vulnerable. So, so I see a need to lift their voices and make support people who are in need right now. And I think it's I don't know what it's like in Netherlands, but in Norway, we are constantly facing budget cuts and constantly facing the tightening of new public management, where we are counting, but we're not really discovering the qualities of our services. So I think peer workers are proving to be kind of a resistance to that, where we are talking about what does it feel like? Uh, yeah, what do I need when I want help? Not how fast can I get well again.
And speaking about cutting the costs is the same in the Netherlands.
Yeah.
But what's in general, the opinion of the Norwegian government towards peer expertise? I can imagine that you are saying, well, if they are cutting the costs, they are not giving very, they find it not very important peer expertise, but still, as we see in the Netherlands, the costs are cut, but still the Dutch government is positive about peer expertise. How is that in Norway?
I think it's actually a bit of the same, and I think it's mm, also but I can see that as peer workers, one of the big problems is that we often have small jobs, like instead of working 100%, we have 30%, and maybe we have a contract that is maybe 6 months instead of some job security. So I think that even though the people who are in the government are positive to peer workers, we still haven't got the same job security as a lot of other groups. So it's a slow process in Norway as well. And the fight to get equal rights as a worker is still going on.
And in the Netherlands, we're always looking to Scandinavian countries because there the life is much better than in the Netherlands. Referring to peer expertise, do you think that in general in Norway, the Netherlands could learn something about your views and perspectives in using the peer expertise?
Yeah, maybe, but I think it's both ways because I remember when I started 6 years ago, we were looking a lot to the Netherlands and looking to the fact teams and looking to kind of the recovery foundation for how we think about peer experts and services. So I think it goes both ways. But I would say that in the last 3 years, maybe we've had a really rapid growth of peer experts in Norway, and actually, yeah, I think that's we have some experiences now in how to work at different levels. We have peer experts who only work directly with people who are struggling, and then we have peer experts that are kind of higher up in the organizations who are developing the services.
Well, speaking about the similarities between Norway and the Netherlands in the peer expertise, it emphasizes again the need of those meetings between European countries. And of course, it's important if Eureco and the European Association of Service Providers for Disability can play a role in it. We would like to do so. In advance, I said to you, I have to be a very keen timekeeper in order to be keep in time. I have a last question, and it's also a question, and I do hope that the answer will be heard by any delegate this afternoon. What's your take-home message to the other participants? What would you like them to do after the event? So they are awakening tomorrow, and then the first thing they will say, well, today we're going to start to implement peer expertise. What would you like to say to them?
Well, there are several things I would like them to do, but I think one of the things, one of the things you can do is there are already several manuals on how to get peer workers and how to work with implementing peer expertise. I know that at least in England there has been one manual made, and one in Norway, but that's in Norwegian. So there's already a lot of knowledge out there that you can take that and then try to transform it and adjust it to your local context. And I would also say that one of the most important things, if you want to have peer workers who are free to do a good job, you have to give them job security. You have to give them a position where they are equal to their colleagues. So because the role as a peer worker often is pretty lonely, and you have to be you have to come up with some new ideas and resistance to some of the things that have been a certain way for several years. So the security and the baseline has to be there. But I will also say that remember that in our services, no matter where we work, we have a lot of people with their own experiences that we don't think about. There has been several there has been places where in the mental health field, they have asked the workers who have always worked there if they have experiences with struggling with mental health, and a lot of people do. So I think that in an organization, you all also have some expertise that you maybe don't know that you have, that you can use. So if you make it safe for people to share their experiences, maybe you can use somebody who's already there too.
Thank you for answering the last question, Oda, and also you gave us some spirit for the discussions in the breakout rooms, and of course I do hope we hear it again during the wrap-up. Thank you very much, and I do hope we will meet each other again, and of course this afternoon we will talk to each other. Thank you, Oda.
Thank you for having me.
I'm now down to two Dutch representatives, Jan Berendsen and Marjonneke van der Vetten. They help with the organization of this event. Jan Berts is CEO of Lister Utrecht and President of Mental Health of Europe. Jonneke de Vette is coordinator of the Dutch International Mental Health Club. They will talk about the development of the peer support movement. Jan and Jonneke, be welcome and the floor is yours.
Okay. I will share the presentation.
Yeah, please, Jonneke.
Okay.
Okay, thank you, Martijn, and all the other people in this audience. Welcome. Yeah, so Martijn told me my name is Jan Benson, and I'm working till the end of the year with Lister in Utrecht, and I'm also the current president of Mental Health Europe. So I have to tell in 2 slides a little bit about Mental Health Europe, and then we go on to the subject of this afternoon, peer work. So, Jonneke, do we get the next sheet, please?
Yes, yes, of course.
So our motto is there's no health without mental health. And Mental Health Europe is the largest independent European network. And we're working for promote positive mental health, prevent mental health problems, and support and advance the right of people with mental ill health or psychosocial disabilities. We have our anniversary this year, 35 years old at this moment, and more than 30 European countries are members of Mental Health Europe, 70 members, and we have our own strategic priorities. Next sheet, please. So I think that was enough about Mental Health Europe, because you are here about the importance of peers in mental health. And so this story is telling a bit more about my current job as the CEO of Lister in Utrecht. And we're working for now about, I think, 15 years with peers in our organization. Jonneke will tell you about the history of peers in the Netherlands. But from my perspective as the director of the board, I think it's very important to establish a strong peer support movement in your organization or next to your organization. So you have to give space, and Oda told you also about you have to give space for people with their own experience, and it's not a thing that you can make. Okay, and tomorrow we go. We give more influence for the peers, and we start the day after tomorrow, and we are ready after a week. It's a long period, and what helps me that I have still today a peer leader next to me, and Martijn Kolen, he's a colleague and also a friend after 10-15 years, and he is our peer leader, and I need him. Really for the last 10 years to change our organization, to change our practice. So my advice is for all the board members in mental health organization, go out and look for a peer leader next to you. Another important issue is that peers are needed in all parts of the organization, not only as a peer worker, not only as a healthcare or as a case manager, but also in your management. And it's the same as Oda told you. If you ask your management and you have a free and a sort of good atmosphere, a safe atmosphere, you will see that I think 20% of your management has their own experience. And every year, after every year, I see more managers coming out with their own mental health problems, and they are very important to change your organization. Next slide, please. So if you're going on with peer work in your organization, you have to write the issues of peer work in the mission of your organization. And it's important you have to embrace and support it by the board. And in my situation, there is a 2-member board, and it's really important that you are both the board members are you're really convinced that you need peers. It's also a part of our list of guidelines for good recovery care, and it's also pointed out in our educational programs at the Lister Academy and the ENIC Recovery College. Next slide, please. And that's for you, Marianneke.
Yes, so can you hear me all?
Yeah.
Yes. Okay. Nou ja, peer work didn't come naturally from the start. It indeed, like Jan Bernd said, it took some time also in the Netherlands. And it takes indeed some courage as well. It started actually in the 60s and 70s when there was this anti-psychiatry movement started, where there was more focus on self-development and that people really wanted to have a say about their experience. They wanted to share their experiences in psychiatry, and they wanted to really improve the services with their say. And that's also the start of the client and family organization. So that started in the 60s and 70s. In 1975 was the first time that ex-clients or clients were involved in a policy development aimed to improve the positions of patients. So this was the replacement of the krankzinnige wet in the Netherlands. So this, yeah, the insanity law. It is also a very stigmatizing name. And it was replaced by another law focusing more on patients and involving them more also in service development. Then in the 80s, we see the deinstitutionalization movement. So actually a movement going from, I think most people who are here in this meeting know, the movement from care in institutions to more community-based care, so that people with mental health problems can live a fulfilling life within the community. And this is still an ongoing process. And we see it all over Europe as well happening. I've done myself research in Moldova, and there it's also, really a still ongoing process. And then in the 80s, in the same time, and a bit in the early 90s, there was this recovery movement that was more reflected in science and the formation of organizations, informal organizations, but also restructuring of organizations and policy focused more on the recovery of patients, so more on the recovery journey of patients, so that actually saying that it's a personal process, not only focusing on the reduction of symptoms, but focusing on the recovery journey of a person with his own, giving us its own meaning, what it is to be well, to be to feel well, to feel better, to have value in society, to give it a broader meaning than only the diminishing of symptoms. And this was also a big part of the peer expertise movement, that actually the knowledge, the experience knowledge is very much key in recovery. In 2012 and in 2013, there was a milestone with the publication of the Dutch peer expertise guideline and a competence profile for peer workers in mental health care, really making it more a topic to really involve peer experts in service delivery, service development and service evaluation. Only in 2016, the Netherlands ratified the CRPD, which is, if you think about it, pretty late. This is I cannot find the word now, but it stipulates also the rights for people with disabilities. And very much the participation of people with disabilities, including people with mental health problems, is a main topic in this. And we ratified this in 2016 only, I would say, because it was started up much earlier. And in 2017, a key publication was made by Wilma Boefink. It was her thesis about recovery, empowerment, and experiential expertise in psychiatry, outlining the importance of peer expertise and also how you could implement it and what the value of it is. And the randvoorwaarden, how you say it, what key points should be taken into account when you want to do this well. And in 2018, only 2 years ago, there's a start of a project, Beverly can tell you more about it later, that aims to professionalize peer expertise. And there they really want to look at the training of peer experts, really embedding them in services, and really also connect an accreditation system to it. And this is actually a milestone also worldwide. So that's something that we can be very proud of in the Netherlands. And Jon can tell you...
as a timekeeper, I have to ask you
yes.
to make
yes, I give the word to Jon.
Conclusions.
Yeah,
yes.
we have only not two slides, Martin.
Yeah.
So okay.
Yeah.
Monica told you about Wilma Boevink, and she has made her thesis, her PhD thesis in 2017, but she started at Lister at our organization in 1998, and so it takes her 20 years to develop a real sort of from the experiment to a scientific program for peer work. So it's a really long time. And while I'm working at Lister for more than 30 years, I was part of this history. And it was at the start, it was, we find peer work interesting, but it was also difficult. But it was okay, a nice addition. And it takes till 2006, 2013 that peer work we discovered as useful and meaningful. And after that, from 2014 till now, we have the experience that peer work is really necessary as a part of your organization. So I think in every organization you have to take all these steps, but I hope that in your organization it takes less than 20 years. But it's really important that you have to face all these phases in developing in your organization. Next sheet, please. Monica is there.
Yes, sorry, I was muted. I'll keep it short indeed. Now, like in the organization of Jan Berndsen, it has been done really well, but there are some remaining challenges that come up. The first one is the clarification of the job role for peer support workers. Second one is setting up organizational support for real power transfer to peer workers so that they don't have a tokenistic role, but a real role in service delivery and development. Benefits, like Oda mentioned, for peer workers, training and adequate supervision to really make their work possible. Another persisting problem is stigmatization at the personal system level. And also a remaining challenge is showing its efficacy and effectiveness. Also to make sure that people know why it's important, that is actually really working. So that were my last remarks.
Okay, so Martin, it's very difficult to tell in 10 minutes a history of 20 years. So we try, and we are really welcome all the people who want to ask us, not at this meeting, but afterwards. Please send an email to Lister, and we can explain to our peer workers. So that was our presentation for you, Martin.
Thank you.
Thank you, Monica and Jan, for your contribution. I noticed already that you both were very modest in asking just 10 minutes, because due to the subject of this meeting, I was wondering why you could restrict it in 10 minutes. I can imagine that you took 15 minutes. Now we go from Norway to the Netherlands, and now to the south of Europe, to Spain. And Guadalupe Morales is a journalist. She is director of the Fundación Mundo, Bipolar, Lancet Commissioner on Stigma and Discrimination, member of the Mental Health Europe Human Rights Committee, WPA, member of the Advisory Board of Users and Careers, and WAPDR, board member representing users. She is not emphasizing about the Spanish approach, but much more about involvement in EU research projects. Guadalupe, the floor is yours. You have 15 minutes.
Okay, let's see. Is it okay? Okay.
The floor is yours.
Okay, thank you. Sorry. Well, I'm going to talk about a project in which I am involved. In my own country, we have been working on peer-to-peer support and peer workers since 2009. But now I'm going to focus my presentation in this project. I would like to say from the very beginning that we don't have, our view is that without rights and without respecting the UN Convention, there's no recovery, no peer-to-peer support or peer workers. That must be from the very beginning the aim to do anything regarding these two aspects. So now I'll start. There's a kind of knowledge that only comes from one's own experience. It is the true experiential empirical knowledge, the fruit of suffering and the joy of overcoming it. When combined with an honest and loyal exchange with others like us, who have gone through the same, the result is prodigious. Only a person who has been there can fully understand and help us heal. This goes beyond empathy. These facts are the root of peer-to-peer knowledge. For us, as I said, we follow the UN Convention on the Rights of Persons with Disabilities. All our activities must include meaningful participation of persons with disabilities. In fact, we promote projects, trainings with professionals. We lead them. So I would say that nothing about us without us. We all know that the CRPD means a paradigm shift in which persons with disabilities are not viewed as objects of charity, medical treatment, and social protection. Rather, we are seen as subjects with rights. This is a legally binding convention. In 2015, the UN Committee of the CRPD reviewed the implementation of the convention at the European Union. One of its recommendations, but not the only one, said that the committee recommends the European Union to ensure to actively involve representative organizations of persons with disabilities, especially psychosocial disabilities. This is a project in which I am involved. It is called Recover E. It's a Horizon 2020 project, a research project. So what about this project? The consortium is composed by 16 partners of 11 countries. Fundación Mundo Bipolar's aim is to have a meaningful involvement of organization of persons with psychosocial disability. We contribute expertise from peer workers and lived experience to all dimensions of the project. Recover E is a unique example of a service user-led organization, is partner and work package leader in a Horizon 2020 project. This has been the first time that a person with psychosocial disability and her, in my case, organization is involved in a project like this. So we train 5 multidisciplinary community mental health teams in 5 cities in 5 countries. So we train psychiatrists, psychologists, nurses, social workers, and service users that after our training become peer workers. What was my role? Together with a colleague, Shuna Banner, we developed an original training program to build the function of a peer workers in a community mental health team for the first time in these sites. We train other health professionals and peer workers on how to work together to deliver care in a recovery-oriented way. Training included team-based training and peer worker-specific training for mobile teams. The duration of this training was 5 days, 40 hours. Among other subjects, we talk about community mental health, recovery and practical planning, transfer from clinic to the home, and also about rights. In 2018, we had this training in Zagreb and Kotor, in 19 Siret, Skopje, and Sofia. Since 2020 and onwards, we have been holding mentoring to our peers. These are some photos of our trainings. This is in Siret, Romania. This is in Croatia and Montenegro. And this last one is, no, this is not the last one, is of my peers in Bulgaria, in Sofia. We had a separate space only for peers. And I can tell you that that was the most amazing and exciting part of all this training, and I guess of all this project. Here are my peers in Skopje, North Macedonia. Well, we evaluate every step of this project. University of Heidelberg is in charge of this evaluation. One very positive reference to our training was that as part of reflections, many participants said interacting with peers and having positive group dynamics enhanced their learning. Most of them, I would say 99% of the professionals hadn't ever had a direct relationship with peers doing something else than being their professionals, their psychiatrists or their psychologists. This is one of my sessions, peers and peers workers, skills and roles. I will go fast through it. We all know what a peer worker is. I would only say that the peer helps understanding the frustration and stigma discrimination experienced by us. We use, of course, the recovery reframing. And which are the benefits and motivation to work as a peer worker? Of course, we think it's a unique contribution. Jan has also already mentioned this. We must or try to be a role model as an educative role team, hope for users and family, reduction of stigma and discrimination. Nowadays, we have stopped talking so much about stigma, and we prefer to talk about discrimination, because discrimination is against the law, and discrimination is in the CRPD. We focus on psychosocial rehabilitation, recovery, and empowerment, and help everybody to live as a citizenship, as a citizen, as anybody else. Of course, we are a bridge function between service users and professionals. Having a meaningful way to contribute and receive a salary. It was already mentioned that usually peers have a small salary and, what is worse, a very short time of work. 6 months, 3 months, and that doesn't allow them to have a way of living like anybody else. And one important thing, in my opinion, giving sense to past suffering when helping others like oneself. Well, skills of peer, especially workers, you all know that. I would just make an emphasis on compassion. Compassion from this at the same level. The roles, we all know those, but I would also emphasize here about rights. I think that peers not only need support and recovery approach, they deserve to know which are their rights and how can they claim for those rights. A peer worker is not a friend, a peer worker is not a doctor or a therapy, and the primary role is inspiring hope. So how does a peer worker work in a community mental health teams? First, the peer worker provides mobile community-based mental health treatment to promote the recovery and community integration of individuals with severe mental illness. This is in our project. Peer services include peer support advocacy, support in developing a recovery plan, engagement and mentoring, recovery support, pre-crisis and crisis support. This is very, very important. It has been reported that our peers have helped very much during crisis. Which are the general challenges on the implementation? So in the first place, as this is a new role, it has usually happened that there's a lack of shared understanding of which is our role. There's an over-formalization of the peer worker's role, too theoretical, and redefine of the peer worker role to fit traditional clinical practice structures and cultural inflexibility. When a peer worker starts working with other professionals, the structures have to change because a new way of doing things has arose. Again, low salaries and lack of sustainability of the job. Usually there's a lack of respect, not in my project, and a risk of burnout. Which are the barriers and challenges to implementations in my own project in Recovery? These were actual reported barriers from peer workers in Recovery. Peers claim to have more clarity on roles needed. They also ask for salary. Salary for peer workers is a new addition to the financing system in the country, and in some cases conflicted with national regulations for disability payment. There's a need to have sufficient capacity to fill in for peer workers who are unwell, on vacations, etc. We are holding since the beginning of 2020 mentoring with the peers. That's my task. Well, we talk about the clarity on role during home visits, peer workers as part in the motivational interviewing, peer workers' role responsibility in management of patients in crisis, and how to tell a recovery story. These are my last two mentorings. This is with my colleagues, my friends in Skopje, North Macedonia. You can notice that we are doing the COVID. And this is also my last mentoring with my friends and peers in Zagreb, which has been my challenges, my personal and professional challenges.
Guadalupe, you have still 5 minutes, please. 5 minutes.
Yeah, I'm finishing. Thank you. Well, it has been a challenge to work at the same level with the coordination and partners. It has been a challenge to have different styles of communicating with different languages, different cultural ways of thinking and working. Remember, we are 16 partners of 11 countries, which has been my achievement. It is, because it hasn't finished yet, a significant opportunity to put in place my knowledge, not having a token role, which is something that happens too often. I have learned from diversity of cultures and levels of health services in different countries. For me, it has been very important to raise the importance of awareness on the UN Convention. And this is something important. I got a salary after 7 years of volunteer work. In all, it is an unforgettable and very valuable vital and professional experience. This is me in Suseva, Romania, arriving minus 14 degrees to impart my training in CRPD. You can see that I'm very happy. In fact, I'm very happy still now. Thank you for your attention. Nothing about us without us.
Thank you very much, Guadalupe, for your contribution to this meeting. We have heard several introductions from Oda, from Marianneke, Jan, and Guadalupe. And I also saw, besides the presentations, I noticed several discussions, opinions about the content which were mentioned. And I think that is a very good warming up for the breakout sessions. As I said in the introduction, it isn't just a manner of listening, but it's also a manner of listening and doing. And that opportunity will arise within a couple of minutes, where you will be a delegate in one of the 3 breakout sessions. I'm hoping to hear from Brussels to make the arrangements for the breakout sessions. Brussels, are you there?
Yes. Whenever you're ready, we can distribute people into the breakout sessions.
Yeah, well, I have one remark. I noticed that a lot of chats I read are already answered during the sessions. But in case some chats are not answered, we will take care for the answering of the chats. So if your chat is not answered, we will guarantee that it will be answered within a couple of days. And I think we can go to the breakout sessions. The division will go automatically.
Okay, yes, I will do it now.
Thank you.
Luke, in which breakout session would you like to go? You're muted.
I would like to go in session 2.
Session 2? Okay, yes.
I have had pre-selected session 1.
Okay. Session 1.
And I'm filling in for somebody who is sick. So I'm not sure in which session I should be presenting. The person who is ill is Dudevsky.
It's Dudesky?
Yes. D-U-D-E-V.
I don't have that in the registration form. First name, please.
Zabinka. S-Z-A-B-I-N-K-A. Have you found her? Is that number 2?
Yes, that is number 2. Yes, I will move you now.
Thank you.
Could I also be moved to 2?
Yes. It is weird. Why?
Hello, Rosanne.
Hi,
How are you doing?
I'm doing fine.
Rosanne, you also have to go to session 2.
Okay.
Can you help us with that, Dimitri?
Yes, of course, yes. I have moved her. I'm trying to see why I'm not able to move you. I shall put you in the waiting room and admit you again, also for Peter.
Okay,
Yes,
thanks.
yes, please.
Yes.
Thank you.
I'll wait.
Hello.
Hello, yes. Which breakout room would you like to go to?
I didn't hear the last bit. So which were the breakup rooms that were available?
There's breakout room 1, which is how do we implement peer expertise in services? Breakout room 2 has implementing peer expertise been proven effective, and what are points for action in research and practice? And breakout session 3, how can digital technology support ongoing processes? Is there specifically technology designed with peers with expertise?
3, please.
Okay. Peter, I'm still having Mark as well. Which breakout room would you like to go?
Me too.
Okay. With Peter, I'm having still.
And my name is now Veroni van S, but I also would like to, my name is Frans, go to breakout room 2.
Yes.
We all want to go to 2.
Sorry, what was your name again?
My name is Frans Spierings. I was filling in
Frans.
for somebody who was ill.
Okay. I don't know why I cannot move. Could you please leave completely the Zoom and come back in using the same link?
Yes.
I'm very sorry. It's just that I'm not able to assign you to breakout rooms. I
That's
do
no
not know
problem.
why.
That's for all of us?
Yes, yes, please.
Okay.
I will
Yes,
do
yeah.
that.
Very sorry.
No.
No problem.
I hope to see you soon. Nou, dat was een adequate interventie.
Louise Christie gave a presentation on the Scottish Recovery Network and how they implement peer roles in mental health services. Michael Norton spoke about his personal experience of being a peer support worker and implementing peer support works into services from peer perspective. And Sara Marcos Esperto spoke about her peer-to-peer project and how they started to apply peer support in their services. And we have a couple of take-home messages. First off, I would like to say that respect and equality is essential in peer work and support. That training can be essential to enable people to use their lived experience in order to help others in their recovery. Lived experience is central to recovery, but also a critical note to look at your own organizational policies and regulations to ensure that peer workers have enough freedom to aid others and that they are not restricted by those policies and regulations. Also, we noticed that there is still a lack of understanding in governance structure and therefore, unfortunately, also in funding when it comes to peer support and peer work. But altogether, I would say that we have had very inspiring and nice examples. And so even when there are still boundaries that we have to overcome, I would like to share what Michael Norton also said in our session, don't give up, we will get there. So thank you all, especially to the speakers in my breakout room. Thank you.
Thank you, Robert, for your wrap-up of breakout session 1. Besides of the video, which can be seen afterwards, we also will discuss with ESPD to summarize the main results of this meeting, because I think we all know that the results of today will be important for the working plan of ESPD, but also for ERECO. But we'll discuss it with ESPD. Now I gave the floor to Germany. Martin, it's your role to give a short wrap-up from breakout session 3.
Yes, thank you, Martijn. In this breakout session 3, we've been dealing with digitalization from 2 perspectives. I had a theoretical input from myself, reflecting this implementation issue from a regional planning and development perspective, and then it was a very nice presentation by Miriam Sachsma and Mark Koning, who introduced their research on digital and to have a take-home message. Maybe generally it's possible to conclude that digital services give us the possibility to extend availability and flexibility of services. They might serve as an addition to on-site support for persons with different needs. But on the other hand side, we could see from the example that digital services aren't a solution for anybody. So when implementing a digital solutions in services, it is important or it's crucial to involve experts by experience in order to come to a successful to something that is actually useful for people. And this could also mean that when implementing in a service, when implementing services in a region, it is important, it's helpful to understand this as a collective learning service, learning process that also involves experts by experience in this process, not only of technically developing solutions, but to adapt solutions for so that they help in an individual context. So far to this.
Thank you, Martin, for your speed wrap-up. Now we gave the floor to Beverly Rose, and she can mention two aspects. First, as a moderator of breakout session 2, the results of breakout session 2, but also giving more in general your view and opinion about the information we all heard about peer expertise and the main things you think that we should take home as a message. Beverly, the floor is yours.
Okay, first I will start as a moderator from breakout session number 2. Number 2 was with the title, Has Implementing Peer Expertise Been Proven Effective, and What Are Points of Action in Research and Practice? First presentation was from Ali Weerman and Beverly Rose about our study and about the experiential knowledge in research by clients as researchers, as co-researchers, and researchers with experiential knowledge. Then we have Hans Kroon, who was talking about the Recovery College, his study of Recovery College Enik in Holland, and the presentation, the last presentation of Frans and Rosanna from about Rotterdam University and a study called Koplopers. I don't know about the translation in English. What I heard were different perspectives, and there was also the different perspective was a conclusion of the Rotterdam study. Now, I liked the conclusion, turning disabilities into possibilities. No longer the needy one, but the needed one, was a nice saying. It is all about collective experience, using all different talents and creating new opportunities. That was all about well, it was a conclusion of the Rotterdam study, but it was the meaning of all the 3 presentations. Maybe we can share the screen, because in the meantime, during the short break, I made some PowerPoint sheets. I wasn't planning to, but I was inspired. Let me see where I got it. Yes. Can you see it? Or not yet?
Yes, we can see it. We can see it.
Oh, you can see the presentation? Yeah. Oh, okay, okay. So the title of this whole event was A New Horizon in Mental Health Care, involving peer experts in research projects, policy and implementation. Well, Eureka was all about inclusive research, and there was also Guadeloupe was mentioning it as well, and I'm a presenter of UCOMS quite often, and also from the User Research Center, and we always say, well, it's nothing about us without us. Then we're talking about the key challenges, the possible solutions, the recommendations, and the take-home messages. I saw a lot of messages in the chat box, and I like very much that there is some kind of a network, because I saw a lot of emails and messages. Let's contact. So there will be and continue. Then about peer expertise. When we look at the conclusion, then we will look at the 3 questions. How do we implement peer expertise in services, point of action, and the digital technology? When I'm going to the summary and reflection, I made some points from the first interview Martijn, you did with Uda from Norway, and then I was going to the presentation of Jan Berndsen and Marionneke van der Vette and Guadeloupe, and then to the breakout sessions. What I heard, well, I heard more points, of course, but there are some points, let me say, as a peer expert, for me, it's quite a focus. The working as a peer expert, whether it's in services or it is in research, is meaning reducing stigma. The more peer workers are known, the more peer workers are in the organizations, the more the stigma will reduce. What we gain by implementing peer workers in the organization, you see that there are different ways of thinking that is a plea for working together. Uda also said, well, brings a lot of more understanding. Working as a peer worker, I hear quite often from service users that I bring hope. That's what Uda said. It's an inspiration to see what you can do, what you offer. And I like her saying that it's also lifting voices. The take home messages. Some of them I present here. Uda said, well, there is a lot of material going on around Europe, especially she mentioned UK, but I know Mental Health Europe's got a lot of information and a lot of other networks as well. Get those manuals, get those information. Besides manuals, I also know a lot of training programs, educational programs they offer. Please use it and share those information. It's about, Uda said, well, get a manual how to get peer experts. Let's say, what are peer experts and how do you get them into your organization, and also how to implement peer experts. She mentioned, and also Guadalupe mentioned, make sure that if you work with peer experts, make sure there is a job security, that peer worker is as equal as other professionals. I always say a peer worker is a professional. So a few years ago, you heard in Holland, you have peer workers and you have professionals. I said, no, you have peer workers and other professionals. I think that's very important to get them equal. Make it safe to share experiences. That is not only about peer workers, but it's also about professionals. I see in Holland that a lot of professionals have also their experiences, but they say, well, that's something for peer workers. So no, even professionals with their own experiences, if the environment is safe, if there is possibility for an open dialogue, you share the experiences. And Uda said, well, give peers a space, and that's also what Jan Berendsen mentioned. So, Jan, just some points Jan mentions. Peers are needed in all parts of organization. It's not just on the floor, but also in a management team. He said what Lister got proven, that establish a strong peer support movement was supported also by peer leaders. They helped to change the organization. And he said, well, the peer leaders he's got is next to the board, is besides the CEO. Also the safe environment. And I don't see that very often in many organizations yet, but I see it more and more, that peer work based on the mission of the organization. If you just say you think peer workers are very important, just show it as well. And take care of education program, to mention some of the points Jan mentioned in his presentation. Then Marjonica, also a few points you mentioned. Peer work takes time and challenge to succeed. If you say, well, sometimes people say peer work is just like a trend, it's a hype. Well, actually it's not. It's just not, it's just we hear more often about it, but it's a hype for maybe 20 years, what Jan already said. It takes time and it takes challenge to succeed. clarification of role and job description. Also what Guadalupe mentioned about equal, especially equal in the job description and also the salary. It's something in Holland I'm doing a study about. So I'm doing a study for these coming months, asking organizations, do you have a job description about peer workers? Are they called peer workers? Are they called recovery workers? Are they called peer expertise? How do you call them? What's the description and how are they paid, etc. Let me see. Organization support strategy, she mentioned, and show that it works. Well, already mentioned that. Guadalupe. Well, everybody should know that real peer workers or real peer experts, that they have a unique contribution. There's also the Rotterdam study. It says, well, we have used all the different talents that we have. Peer workers can have a role model that's mentioned by Uda, like we are bringing hope and inspiration, reduction stigma, already said, giving sense to past suffering by helping others. I know that from the Rotterdam study, it was said it is a great feeling to be part of the solution. It's also a nice one. And something I see very often in practice, it's a bridge function service user and a professional for a better understanding and a better feeling. And of course, the equal rights as well. If you ask me, what are the main points to take home and what is the reflection? Well, first of all, I liked it from the presentation. Challenges ask for choices, which give certain solutions. That's first of all. So if your organization's got a challenge, you have a challenge, ask the best questions, have some choices, and then figure out the solutions. If you have a peer supporter who can think from their talent, from their different talents, to be a part of the solutions, it gives a multiple way of going ahead to the solution, but also a multiple great feeling for the peer worker as well. The saying, there is no disability, just possibilities. It's just nothing about us without us, and there are no disabilities, just possibilities. And it is a way of looking at it, but it's also a way of finding the right possibilities. And best of all, I think, to give it to you is dare to change your perspective. If you dare to change your perspective, you dare to change the perspective of the organization. These are my words for now. I would like to, on behalf of the organization, I would like to thank you. And the beginning of the new year, we will have from the User Research Center, we will have some webinars, also including from the webinar of UCOMS. So if you are interested, give me your email or your name, and you can have your invitation.
Thank you, Beverly, not only for your opinion about this session number 2, but especially your general retrospective view about the first part of this meeting. I was just talking about the necessity of, besides having the video, also have the main take home messages, and I'm very thankful to you, Beverly, that you already gave us your script, which we can use from Eureka. Afterwards, we speak about copyright. The last 2 men I will give the floor, which is Luc Zeldelo. He is director of ESPD, who from the perspective of ESPD gives his view about this meeting. And after then the chair of ERECO, Hans Schneider, who will give also the opinion and consequences about this subject for ERECO the next years. Luc, welcome, and the floor is yours.
Thank you,
keep in mind
Martin.
the restricted time.
Thank you, Martin, for your introductory words. Good afternoon, everybody, dear participants. Thank you for your contribution to this very interesting, fascinating event. And in a way, it is maybe also the right moment to announce that we will have another event of the ERECO Corporation in March 21, so next year, in not more than 4 months from now. We will, of course, inform you on the topic, and who knows, maybe we can have it in person. So that would be fantastic, I think, because having this type of meetings online is completely different from having the possibility to have a more involved and closer face-to-face discussion. So thank you very much, Martin, to you for moderating this event and for your team for organizing it together with the others, of course, but I think that you did a wonderful job. For us, ESPD, European Association of Support Services for Persons with Disabilities, we represent around 17,000 organizations active across the European continent. This cooperation is very, very important. When we started this initiative a few years ago, it was for us and by us seen as an instrument to bridge the gap between the researchers' world and the world of the service providers. And today's discussion, I think, made clear that indeed, thanks to this type of conversations, we can bridge this gap. The uniqueness of this ERECO Corporation, for those that are not aware of it, is quite significant, I think. We have researchers on board from many different universities and research agencies. We have authorities and actors on board that represent authorities, that work in close cooperation with authorities. We have service providers on board, and we have organizations that represent the people supported on board as well. And bridging this gap, I think, between research and practice is so important. We can learn so much from one another. We can push, the provider side can push researchers to do research work that really contributes to a better quality of life and better quality of services. And new researchers can push us to implement, to provide services that are up to date and address the issues in a correct way. And what we discussed today is absolutely essential. The importance of mental health, I don't think that we have to discuss that, especially in COVID-19 times. Mental health is absolutely essential. This is all over in the media, in research papers, and so on. And I only can subscribe once again, no health without mental health. It was said by one of the speakers in the breakout room where I was, and I fully support that statement. And we only will be able to work on mental health, on psychosocial challenges people have to live with, if we indeed develop community-based approaches, and if we work with and enriched by people that have a lived experience. It is peer learning, it's peer workers. These concepts are in a way very challenging for many service providers, but we should indeed embrace them and make sure that indeed we implement these concepts in this very important workforce that we have in the social services sector. I don't know whether you are aware, but in the support services for persons with disabilities, and that of course that group goes way beyond psychosocial issues and mental health only, and talking across disability, across disability services sector, we have data proving that between 7 and 8 million professionals are active. And I hope that amongst these 7-8 million professionals, there are many people with a lived experience, because their contribution is absolutely essential and crucial. And I think that, and that is the learning I take with me as a network leader. What I take with me is that we have to develop human resources instruments so that we can bring the peer workers, as they were called here, people with a lived experience, in a correct way, in a meaningful way, into the workforce of the support services and the social protection machinery that is built. We have to do that in a meaningful way, and that means with a correct status, with a correct salary, like all the other workers in the field. And we know that there is an issue there. Social workers, people working in our field, are underpaid. We know that. We try to work on that together with other actors, also in social dialogue mechanism that we have at a European level. This event is organized on a very timely moment. Politically, it is very important. Next week, we have the European...
Look, you have now some 1 or 2 minutes.
Thank you very much, Martijn. I will try to respect that. It is a politically very important moment. Next week, we will discuss the next disability strategy 21-2030. We are discussing the implementation of the European Pillar of Social Rights. Long-term care is on the European agenda. And of course, as said already, COVID-19 is very, very high on our agenda. Dear colleagues, for me, this event was very important, very enriching. As ESPD, we will develop projects and activities that will help us to tackle these issues. We will contribute with the learning from this event in the debates on the Disability Day next week. And we will further develop the ERECO cooperation to make sure that we keep on learning from you and inspiring you for research. So thank you very much. And again, Martijn, you did an excellent job. So keep on doing it. Thank you.
Thank you, Luc, for your positive and enthusiastic words about the activities which ASPD will go to adapt after this meeting, and also pronouncing the next meetings next year. And I do hope it's not an online meeting. The last words are for Hans Schneider, who is the chair of EURECO. And I do hope, Hans, that you will make a link between this meeting and the working plan for EURECO the next 2 years. Hans, the floor is yours.
Thank you, Martijn, and thanks to all of your colleagues for having organized this meeting together with Ronan, with Renaud, from EASPD. And I have to say, I really enjoyed it this afternoon. I wasn't quite sure what would expect me. Again, would it be another boring Zoom meeting? But I'm really impressed how structured and how communicative this event has been so far, and it was really stimulating, and I'm very happy that that it was possible to have this meeting. At a certain point, we were discussing, will it be possible? Will it make sense to do it this way? But we learned something from EASPD in COVID times. Look, for me, this was very important what you said, never cancel, but adapt. So never cancel, and this was a very good advice. So it was good that we have not canceled it. What is this basic idea of EURECO? When we founded it, established it, and we came together first in Brussels in March in 2017, it was to create a special platform where indeed researchers from an academic background and from research institutes that were ambition came together with with people from the practical field, from service providers that are interested in research. And this is, as you know, not always a relationship free of conflict, because there's an inherent contradiction. So researchers have the role to formulate a corrective against practice, and very often we are the ones who make aware that there is this famous implementation gap that consists of what should be done, how services should develop because of good reasons, and on the other side, the reality in the service system that is very often differing from that. But as of course we all know, the implementation is a very important issue, and we also know that implementation is depending on certain developmental paths that we are all on, and we are all in a way restricted to. So when Beverly or Martin, when you've been talking about take-home messages, this is, I would say, was very helpful. One important take-home message was peer expertise in research, in practice, and in implementation serious. Take it serious, but of course, what does it mean? What does it mean for a person like me being engaged in a regional situation? And this is a point that is important for the specific profile of Eurico, because we believe that to implement the big words, the nice words, the gentle words of the UN CRPD is most relevant for the local political level. It is where people live and where practices and routines structure day-to-day behavior and create problems. So this idea of developing the environment for making good work in terms of service structures, in terms of intelligent funding structures, in terms of good professional work. This needs also, let's say, a local development approach. And this is something that is also part of the Eurico idea. I personally I had so many questions during this meeting, and I think this meeting is not the end of the story, as all of you probably would agree with, because there is this more general question of whether involving people with expertise as users of mental health services in research, does this lead to good research? Does it lead to good research when people are involved into practice? Or what does it mean to implement people with expertise in the implementation? And what does it exactly mean in terms of how do you do it in practice? And not do it as an alibi, but really try to take things serious. And there are still many questions open. So it's what I want to say. There's it's not the end of the story. We have to go on with it, but we do it because we while coming from different developmental paths. And of course, you are swimming in Dutch waters. People in Spain are swimming in Spanish waters, and in Romania, they're swimming in Romanian waters. And it's not the same, but I think, and this is what I have also been learning from the introduction, we have a common story. When the story of mental health services was presented, I could or many people in Europe could identify with it. This is true, but of course, it has led to different situations. And I'd say my last point, this is what Eurico is about. What can we make, coming from our different national developmental pathways what can we make when we come together in terms of developing research questions that create added European value. And I think we will definitely take this idea of peer expertise in our next meeting, also in the field of mental health, but we could also regard it as a general standard, but it has to be necessarily concretized. It has to make, practical, to be made practical. I can see many possibilities to develop really relevant research questions in a European perspective out of what has been discussed here today. Thank you, Martin.
Thank you, Hans. Thank you all for your contribution to this meeting. We are now coming to an end of the meeting. I think we have heard quite a lot of interesting aspects. As you heard at the last part, that hearing Luc, Beverly, but also Hans, that we will take it in our work plans for ASPD, but also Eureco. And again, Beverly, I want to thank you and compliment you for the text you already made, which we can use in our work plans. I want to thank Jan Berndsen and his colleague Marianneke van Vette for the cooperation with Zonneweg in organizing this meeting, and of course to my colleagues who have done quite a lot of tough work to arrange this meeting. Although it's online, I think we have still got a lot of information which can be used in the next future. And maybe I represent the general opinion. I do hope we see each other next year lively in a meeting in Brussels or somewhere else. Thank you very much for your cooperation and membership of this meeting. And as some say, we are meet again. Thank you. Goodbye.
Oh, I'm still on.